Okay, there we go. We are recording. So, hey everyone, welcome to the inaugural first ever Prism Integrated Health Lunch and Learn series here with registered dietitian Cindy Dallow. Hi, Cindy. It's nice to see you.
Hey, Max. Thanks for having me.
Today, we are talking about emotional eating and mental and physical health, and we've got some slides to show, but really this is more a conversation and just some exploration around relationships with food, how it impacts physical health, how it impacts mental health, and some steps for, what folks can do to improve their relationship with food if they find that they are in fact emotional eating.
Definitely.
Yep. So I guess let's get right to it, and I'll start by saying that really you were the one who brought this to my attention by those studies that you sent. So I'm going to share my screen right quick and show the headlines for the studies that you sent out, and we can talk a little bit about those and why this research is important. Hey, that's us.
You know.
So we're going to come here. We're going to hide the screen. And so, surprising no one, right? Depression and anxiety tied to less ideal cardiovascular health in young adults.
Yes.
Yes. And then the other one reads emotional eating tied to risk for diastolic dysfunction. And so I know what the headline of the first one means because I do mental health, but can you tell us a little bit about what diastolic dysfunction is?
Well, I'm not an expert in that topic at all, but it does relate to blood pressure and can affect a person's regulation of their blood pressure, which, really isn't surprising when you think about emotional eating, because emotional eating involves a fair amount of anxiety, and anxiety can affect our blood pressure. So I think there's not a huge surprise there. However, I would guess that most physicians and many health professionals would not have thought that emotional eating could affect diastolic dysfunction or cardiovascular health at all. When we think about those kinds of things, we think of, exercise, high-fat diets, smoking, the traditional risk factors for heart disease. But I would guess that most people wouldn't realize that emotional eating is tied to them as well. And from what I've been able to read, there's not a lot of research on, emotional eating and cardiovascular health, or really any other chronic conditions like that. There's not a lot of research, but there is some. And some of it's indirect, like that first study with the college students that, depression and anxiety, affect our risk for heart disease. Well, depression and anxiety also can lead to emotional eating, or it's a chicken and egg kind of thing, right?
Right.
So, but yeah.
Yeah, so it's cyclical, right? Like, for instance, if we're feeling anxious, we might eat to feel in control of something.
Definitely. This is what I see with the clients I've worked is, and it's more than just anxiety, because we all feel anxiety, right?
Sure.
I mean, that's a common thing to feel. And with people who experience emotional eating in consistently and in kind of a negative way, it's depression, it's the anxiety, it's basically not being able to regulate their emotions. And also, from what a lot of studies show, they tend to internalize what's called a thin ideal, in the sense that they think that they should be thinner. Not everybody who emotionally eats has this, but there is a connection there. And they just don't have a way to regulate their emotions. And so the result of that is then eating to self-soothe, to kind of feel better, which I think we all do, and I'd like to talk more about that as we go
Yeah.
along. But I think it's not just anxiety. It's how a person regulates their emotions.
Hmm.
Yeah,
Hmm.
or
Yeah.
lack thereof.
Yeah. Or, I think anxiety, like we tend to think about anxiety and behaviors around anxiety as trying to regain some form of control,
Yeah.
right?
Mhm.
And spaces
Mhm.
that,
Yeah.
and there's all of this social messaging that tells us you
Yes.
can control your food, you can control
Yes.
what your body looks like, you
Yes.
can, you
Yes.
know,
Yes.
which is where restriction comes from. And so,
Exactly.
uh
Exactly. Yeah, diet culture just it kind of pushes this in our face that we should control our eating habits, control our appetite, control our weight. It's all about control.
mhm,
And the reality is we cannot really control a lot of those things.
right.
When it comes to emotional eating, we are emotional beings. We do experience emotions. And, when you look at like most social activities that we go to, they're centered around food, right?
Mhm. Yeah.
And so even positive emotions, holidays, what do? We eat,
Mhm.
around any kind of celebration, weddings, graduations, whatever, there's of course a ceremony, but there's always food. And so we associate and those are positive feelings,
Mhm.
but we are emotional beings. So I personally think it's a normal thing to
Yeah.
some extent, um,
Certainly.
to eat emotionally, and that's
Mhm.
that's something I would like to chat a little bit more about.
Yeah. And even sort of go pushing that a little bit further, that's how we're taught, at least in my family, right? And I
Hmm.
think this is, might
Hmm.
might be more
Hmm.
specific for like female-bodied folk who have been
Hmm.
socialized this way. But like,
Hmm.
when I, for instance, as a kid, walked in my grandmother's house, have you eaten yet? Right?
Right.
When somebody experiences a loss, we bring over a casserole. Like,
Right.
there's like a significant caretaking component that we're also given when it comes to our relationship with food.
Yes.
And so, like, when we're talking about being in relationship with ourselves, then it could be like construed that emotional eating, right, is a
Hmm.
is a way of taking care of ourselves, even if,
Comfort. Hmm.
yes, comfort, right? Then we take
Yes.
it a little bit too far, it becomes an unhealthy behavior. But like, there's the messaging there that food is about caretaking and about nurturing and about
Right.
creating safety and comfort.
Right.
And so, yeah, it's we we are sold such different messages, right? We have
Yeah.
to be one way while also like exhibiting the exact opposite behavior.
Exactly.
Um,
Exactly. We get a lot of
yeah.
mixed messages about food and eating when
Hmm.
we grow up. And I'm a parent too, and I know how tough it is when you're, feeding little kids and you,
Hmm.
you want them to eat. And so you want them to eat everything on their plate. But that's actually one of the worst things to teach a
Yeah.
child is to eat everything on your plate,
Hmm.
because it's basically teaching them to ignore their fullness and
Right.
satiety cues. So yeah.
Yeah.
Mhm.
Okay. So let's talk then about how emotional eating impacts physical health, because you do more of the
Mhm.
body stuff and I do more of the brain stuff.
Mhm.
So let's
Mhm.
talk about like, how does emotional eating impact cardiovascular health or fitness or any of our like our health measures, which
Yeah.
I know are
Yeah.
somewhat skewed, right? But like basic health measures.
Yeah. Well, first of all, people who eat emotionally in a negative way, because again, I think you can eat for
Mhm.
emotional reasons in a positive way. But if
Right.
they're doing it in a chaotic, uh, negative way, for lack of a better word,
Hmm.
they can actually do that for quite a while without showing really any kind of outward effects and or affecting their health in a big way. So you can kind of get away with that for a little while, but after a while, it will start to affect physical health. And I guess one of the ways that I see it with clients that I've worked with is just their stress level. And then, of course, stress affects their sleep and their ability to focus, their ability to get work done. And then in those people who are, and this is something that happens a lot, people who restrict because they think, oh, I shouldn't eat too much. I need to eat, it's either I need to lose weight or, gosh, I shouldn't eat that. I shouldn't eat too much of that. And or they're following one of the most popular diets out there right now, intermittent fasting, and they are trying to fast. So what happens that I see in clients that I work with, at least, is they start off feeling in control and not eating, restricting, fasting, whatever. Stress happens, they're a college student and they take an exam, or they get in a fight with their significant other, or, whatever. There's a million, we all know, ways to be stressed. And if they're tired, stressed, and around very good tasting food, what usually happens is then they start to eat, they start to feel guilty, and then they overeat. And in some cases, for some people, it becomes a full-on binge eating episode. And so it can lead to what's called binge eating disorder, which I know you're familiar with, being a therapist. Or it could just lead to people feeling extreme guilt and self-loathing. That's what I hear, is like, I hate myself. It's disgusting. I'm disgusting. I can't control myself, all those kinds of things. Well, if you have those kinds of negative feelings frequently, that can affect your health. It can affect your gut. There's been studies that show that, intense stress and anxiety can affect our gut microbiome, which is a whole other topic. And then if it affects your gut microbiome, then it's going to affect everything else. Blood pressure, as we've already talked about, it can affect our ability to focus. So, and then just energy levels, if you're constantly going up and down and up and down, you're not going to have a lot of energy to put toward other things in your life and other relationships. And so, you can see where that all leads. Yeah. I mean, as far as like other chronic conditions, like, diabetes, cancer, stroke, and all that, I don't know if there's research to show, but I kind of think stress, or that the intense stress like that, not just the average everyday stress we all feel, but like really intense stress, and the self hatred, that just infiltrates our bodies, our physical body, in so many ways. So,
I think another way that we could talk about that is like, you're unintentionally, not you, but we are unintentionally exposing ourselves to like internalized chronic trauma, right? By having this negative dialogue. And we know research show that like our bodies do hold that.
Oh yeah, definitely.
With all of
we hold on to that, right?
We hold on to that. We hold on to that in inflammation, in muscle pain, in diabetes, in high blood pressure. Like, there are actual physical outcomes for that sort of mental health, trauma-based stuff.
Definitely.
Yeah. What I think is really interesting, and you mentioned this earlier, is that so let's say that somebody is emotionally eating, right? And they're doing it for a time, for whatever reason. But talking about the way that it impacts sleep, right? So like, from a mental health perspective, sleep is like the crux of mental health.
Exactly.
Because, when you're not rested, everything else is like out the window. We don't have the energy to hold the boundaries with the people that we want to hold them with. We don't have, we don't have the energy to do the stuff that we work on in therapy. And so it's really easy to regress, and then we go through the whole shame cycle. And, I think that maybe it's worth mentioning that a lot of times emotional eating is not, it's comfort food, right? It's not stuff that is like all that healthy. It's stuff that
it's typically restricted.
Well,
that either makes us feel good, or we have some kind of connection to somebody giving us love. You know, like
Yep.
one of my grandmothers was the typical grandmother, always making cookies and, you know,
Mhm,
giving me cookies and love at the same time. And so
mhm,
that's, you know, to me, comfort food right there,
mhm,
because she was giving me
mhm,
comfort, right? So
mhm,
I think we all, you know, we all have comfort foods.
mhm,
But the problem is when people eat for emotional reasons in a negative way,
mhm.
they well, first of all, they're not aware, usually not aware of what specific emotion they're feeling.
Right.
And that's a key point right there,
Mhm.
as
Yep.
awareness, which we can come back to. Um, big key point.
Yep.
But they think it's wrong. And that's where I think the messages we get from our society come in, because a lot of us
Mhm.
are taught that you shouldn't eat for emotional reasons. You
Right.
know, don't do that. In fact, most diets that you read about or try to follow will tell you not to eat for emotional reasons. And I happen to think that's wrong. I think
Yep.
it's actually okay to eat for emotional reasons. It depends on how you do it.
Right.
So,
Yeah. You know what's interesting? Um, a f- so I've worked with many clients who have had like histories of disordered eating, right?
mhm,
Who
mhm,
um, will will like straight up dissociate while they're eating, and then look down and be holding like a candy bar wrapper, and
mm,
it's empty, and they have no memory of,
wow.
you know, they were like totally not present for
Mhm,
the
mhm.
experience. And so what I started having them do was carrying around a Sharpie, and whatever it was they were eating was right on the label of whatever that they were eating, be it yogurt, Snickers bar, McDonald's food. Like, what is it that I am eating? What
Mhm.
is this thing? We have to name it. And then when we name it, we can deal with the feeling. And it's not actually about the food, it's about the feeling.
All about the feeling.
Right.
And that's one of the steps that the second step that I use when I work with people with emotional eating. The first step is to put in some kind of pause, some kind of delay,
Yeah.
slow down,
Hmm.
center yourself, you know, because
Hmm.
I think when we get anxious and stressed and angry or depressed or whatever, I know it's easy to just all those feelings snowball and, you
Hmm.
know, it just, you know, so I think one of the first things to do is just kind of stop, put in a
Hmm.
delay. But the next one though, I think is kind of what along the lines of what you're saying is look at what exactly are you eating, or if you haven't started to eat yet,
Hmm.
what are you feeling? I mean, are you angry? Are you depressed? Are
Hmm.
you sad, just temporarily sad? Are you anxious about something? You know, try to really identify what
Hmm.
exactly it is that you're feeling,
Hmm.
and and then there's some other steps that we can talk about, but
Yeah.
just identifying what it is that you're
Hmm.
feeling can help you get some help for that.
Hmm.
So
Yeah. Yeah. And then, I mean, at that point, when you have paused long enough to identify the feeling, usually you're more like you're in tune with your body, right? So you're able to identify whether you're actually having a hunger cue. And even
right.
if you're not and you still decide to eat, you at least are in your body
And
and
in your body, or at least closer to that, and
yeah.
in the moment.
Hmm.
And awareness and mindfulness, being more mindful, being in the moment, is a big part of treating emotional eating. It's actually part of dialectical behavior therapy. One part of that is mindfulness and just learning to be in the moment and learning to um, becoming more able to just be in the moment and not do whatever it is you want to do, which in this case would be eating, and
Hmm.
being aware of what you're feeling, being in
Hmm.
the moment, slowing down. And that's something I work with a lot of my clients, because a lot of times when they say they're eating emotionally, it's a very chaotic situation, and there's a lot of stress or there's a lot of things going on around them. And so one thing we work on is just slow down,
Hmm.
sit down if you can, sit down,
Hmm.
take a
Hmm.
centering breath,
Hmm.
but think about what is it? What's going on in my mind? What am I feeling? try to identify that, like we talked about. And then, and this is something you probably know more about than I do, but is kind of observing, like taking more of the observer role of what you're experiencing, observing yourself, feeling this intense emotion about whatever situation it is going on in your life. Try to take more of an observer role, and write it down, and think about, what are some ways that I can get help, or what are some ways that I can not feel so bad, not feel so stressed, other than eating. So like it could be calling a friend. It could be going on TikTok for 15 minutes or Facebook or whatever. Sometimes a distraction like that actually can be healthy, for a short time, because it kind of puts in a delay there. Go for a walk, obviously, would be one of the best. Calling somebody, scheduling an appointment with a therapist at Prism Integrative Health. Right. But this is one thing that I have learned is, and what I help people with is, if they really want to eat, they really want that chocolate cake or that pizza or that McDonald's food or whatever it is. What I teach people is, go ahead and have it, but take that food, put it on a plate, and sit down. Okay. Because I think one of the things that helps later on in the process is becoming more attuned to hunger and fullness. And emotional eaters are not as in tune with that. And I think it's very hard to be in tune with hunger and fullness when you're standing up. I know that sounds strange, but it's easier when you're sitting down. And not looking in the counter or in the cupboards, in the refrigerator, in front of a computer. It's easier if you just sit down and pay attention, put that food on the plate. And there's this whole mindful eating exercise that I go through with people, but it basically slows the process down and allows them to think of other ways to get help, but also to go ahead and eat the food and experience that food can make us feel better. There's no doubt about that. You have to realize, and this is one thing I hopefully help people do, is tell themselves, this food is going to temporarily make me feel good. That whatever comfort, that food is going to help me feel good, but it will not take away the problem. So as long as they say that to themselves, this is going to make me feel good right now, but it isn't going to take away the problem. But right now I'm going to go ahead and have it, but I'm going to eat it in a very slow, intentional way. And I'm going to enjoy every bite. And when you approach emotional eating in a more intentional, more focused, positive way, it becomes a whole different experience. And you don't have the guilt. And the guilt and the shame and the disgust that happens after emotional eating that's the problem. It's not the actual eating, in my mind. That's how what I believe, at least.
Well, then it cycles, right? Then we have the shame cycle, and we're eating because we were ashamed that we were eating, and it's
a cycle.
Yes.
And dieting plays a big role in that. The dieting.
Absolutely. And so what I hear you saying is really like, it's twofold, right? And that's really what dialectic behavioral therapy is sort of like, it's sort of like saying in improv comedy where we say yes and, right? So like, yes, we know that's one thing to be true. Yes, there is a problem here. It is a long-term thing that needs a long-term solution. And also, I want to eat this piece of chocolate cake because it's going to make me feel better for the next 30 minutes, and it's going to slow me down enough to find a solution, right? So we're granting permission, and we're welcoming the short-term solution, while also acknowledging that there needs to be a longer-term solution too.
Right, but I think that's what most people who are in that situation of emotional eating do not do that. They see themselves as a failure because they gave into that desire to eat the food. They didn't control themselves. So they see that as a failure, and then that leads to the self, hatred, so all the negative stuff that people say to themselves after they're in situations like that. So I think right there is like where therapy and working with a dietitian can help, because we can help them see that it's not the eating or the desire for comfort food. That's not wrong. In fact, that's extremely normal. And I think normal and healthy. It's how you go about that eating process. And the more you become more aware of your feelings, what's going on in your life, what's driving all of this, why you're in this situation, you can find other ways to cope than food, because you don't want to use food all the time. You don't want this to be a thing where that's every time you have a negative emotion, you go and you sit down and you eat your food. You still have to find ways to handle that stress or whatever caused that emotion in the first place. But eating and when you're emotional in a positive way can actually lead to better coping, getting better coping mechanisms. So yeah.
I think I'm glad you say that, because that's why we talk about all of the different types of interventions that we can have in therapy, right? Because we know that if you rely on one intervention too much, the efficacy decreases.
Right.
Get used to it. It's not as impactful. If you are taking a bath every night for stress management, you are really going to love that bath for like the first 3 times, and then it's not going to be as effective.
Right. And you didn't address the original issue. Yes.
Exactly.
Yes.
And so eating emotionally sometimes could actually be a tool.
Exactly.
Right? In a very diverse and well-rounded toolbox for managing feelings.
Exactly. Yeah. Because if you do it in this positive way, which includes slowing down and tuning in to internal cues for hunger, fullness, satiety, and that's intuitive eating, and that can actually come a little bit later. But this whole process of eating positively includes awareness and just being aware of what you're feeling. And I was just trying to think of the name of the therapy, ACT, acceptance and
commitment therapy.
Acceptance and commitment therapy, which that focuses a lot on acceptance of yourself, acceptance of the emotions that you have. And a lot of people think that acceptance means that you're not going to change or you're not going to do anything about it. They're just like, okay, well, this is the way I am. But actually, what a lot of the research shows is that it's the opposite, is that acceptance, true acceptance, actually can facilitate change. So helping people to just accept where they're at, accept the feelings that they have, accept that they like comfort food can be a big step. Yeah.
Yeah, because really what we're talking about is growth mindset, right? Like when you are accepting yourself fully or accepting ideas fully, that creates more emotional space and potential for you to move in a direction that feels more comfortable and like grow and flourish.
Exactly.
Yeah.
Right. Right. Exactly.
Yeah, that makes a lot of sense. So you have some slides, and I want to get to them because we've sort of been circling around them. I'm going to come back and I'm going to share the screen because I think that this will be a helpful tool for our viewers who are turned in. So let's get here, share the screen, hide the little notification. Here we go. So these were the articles that we started with.
Right.
Here. Okay, so some possible causes for emotional eating. Let's do it.
Yeah. So there could be a lot of causes of it, but some of the ones that have come out in the research, the first one is, I think, a big one, high dietary restraint, which you could basically call that dieting or people who restrain themselves from I mean, we all, there's levels of restraint when it comes to eating. There's,
Right.
yeah, I think I'm going to pass on that second helping because I feel pretty good, and it's no big deal, right?
Mhm.
But the kind of person that has high dietary restraint is, and I see a lot of people like that. They're very, very concerned about eating any extra amount of food or any type of food. And it's to the point where it affects other areas of their lives and maybe relationships with other people. So if they have a high level of dietary restraint for whatever reason, if they break that or then end up eating the food that they think that they shouldn't eat or the amount that they shouldn't eat, then it's kind of like what we were talking about a little bit earlier, is what happens for some people is then they binge. That's like,
Yep.
And I've actually read in research papers that this is called the what the hell effect. Like, okay, well, I broke my diet, so I might as well go ahead and just eat everything else.
Yeah.
They have this high level of restraint, and then all of a sudden they go to a party and they the restraint is broken because there's all this great food. And so then they're like, well, I already, so I might as well just eat the rest of the night. And then in some people, this can lead to bulimia because they feel so bad about themselves and then they end up purging to get rid of that food. So high dietary restraint, I think, is one of the most common ones, or at least that's what I see a lot of. And then the second one is poor interoceptive awareness. And this is actually what intuitive eating teaches, is how to be more aware. It works specifically on interoceptive awareness, which basically is being more aware of your internal cues for hunger, fullness, satisfaction, but also being more aware of, like we just talked about, emotions, what a person is feeling, helping you to be more aware of what emotion you're feeling, what it is, what's going on in your life, just be more aware.
Yep.
And so not having that kind of awareness can sometimes lead to just eating, somebody's stressed at work, but they don't really realize it, and they come home and they're just stuffing themselves with pizza and all kinds of stuff and just eating all evening long. I work with a lot of people who eat a lot in the evening, and so I come back to that. But I think some of that is because they're not aware that they are stressed or angry about something or frustrated with somebody at work. And so they just start eating.
Yep.
So, and then the third one, alexithymia, and I'm not even sure if I pronounced that correct. I'm not as familiar with that, but that's basically, it's kind of another word for,
I'm having trouble hearing.
Alexa thinks that you're talking to her.
oh my gosh, I'm sorry, that's so funny.
That's hysterical.
That was funny. Okay, so I'm gonna have to, I just won't say that word.
Yep.
Anyway, basically it's eating, having dysregulated emotions and not being able to regulate emotions and then turning to eating. So it's just kind of I don't know, it's a weird, it's actually very similar to the fourth one, emotion dysregulation. And again, that's just not really being able to regulate emotions. And this just makes me think about parenting and kids. It's, you have little kids. My kids are grown now, but I remember reading those books to my kids about, what are you feeling? Are you happy? Are you sad? Are you, and all this. And, that's just so important. It's so important to teach that to kids, to help them know what they're feeling. But then to remember to do that when they're in adolescence, because they, we tend to forget those things. But speaking from experience,
yes.
So emotion dysregulation, that is one of the things that the ACT and the DBT, dialectical behavior therapy, and the acceptance and commitment therapy, both of them really focus on learning how to regulate emotions. I've worked with a few clients who were also getting that type of therapy with their therapist, and it was amazing the difference that made. Just that one right there, I think can make
Yes.
a huge difference.
Yep.
Right there. The last one, I really don't know much about, but I included it because it was from this reference here, reverse hypothalamic pituitary adrenal stress axis. I think we'll leave that to maybe one of your more medical people.
Yeah, that's good. So we know the the pituitary gland is in the brain, so we're talking about probably a hormonal thing. Would be my guess.
Right. And I know antidepressant therapy is prescribed for hypothalamic pituitary adrenal stress axis. But sorry, I don't know anything about that. But basically, a lot of it is just learning to understand yourself better, understand your emotions, again, being more aware and learning how to regulate emotions, along with, I mean, that's all good, but along with that process or way of thinking that emotional eating is okay. It is not wrong.
Yeah.
So, because I think, I mean, there are some therapists that I have talked to in the past that haven't got that part of it. So they help regulate the emotions, but still kind of give that message that don't eat for emotional reasons. But it kind of is counterproductive, I think. So.
Well, it is, because, when you have a therapist telling you not to do something, then it gets real shamey.
Exactly. And it plays right into the whole idea that you should restrain yourself. You should control your appetite, which is impossible to control your appetite. Yeah. So anyway, that's just not good. So that having that piece that eating for emotional reasons is okay. It's just how you do it.
And, I think part of this to sort of, my brain is going in like a million different directions. So
mine too.
What I'm hearing you say is that we really need to improve what we in mental health call emotional literacy, right?
Yes.
So being able to really like identify and pinpoint and communicate specific, like the breadth and scope of emotional experience, right? Good to bad, happy to sad, to angry, and all of the nuance, right? Because then that's really when we can find, what we do is about looking for patterns in people's behavior and their feelings and then addressing them. And so, I think what's interesting is you and I were having a conversation a couple weeks ago around like disordered eating behaviors, and gender. And so part of what I'm coming up with here is like when we're talking about heteronormativity and cisgender men, like who are socialized to really think about, to feel, right, or express in very limited capacity. We've got anger, we've got happiness sometimes, but not too much because it might make you appear weak, right? And so like I think
yes,
I'm just posing a hypothesis here that maybe when we're dealing with emotional eating, or eventually down the road, like disordered eating behaviors in menfolk population, a lot of it has to do with the shame that they experience around like having a full emotional experience and not being able to communicate that. So instead of saying, hey, I'm feeling this way, we're saying I'm a man and it's manly for me to eat a lot, and so I'm going to eat my feelings, and also it's going to be construed as like this positive social thing.
Exactly. Whereas that would not in a a female person.
Yes, because women are expected to eat like birds and be skinny.
Exactly.
Right.
Oh, that is so pervasive. And I mean, I see it even in groups of women that I've, business groups that I've been in, they make comments about eating too much, like, or that they have to go out and run or exercise more now because they had that. And, it's just, no, it's okay to if they have a second helping, well, now I'm going to have to walk an extra mile. Well, no, not really. You can have an extra helping and
It'd be
Let
done.
it be.
Yeah. And, I think the other part of that is like there's this acknowledgement that bodies are static. But like our
Yes.
bodies are living, breathing organisms that are
Yes.
changing every day. It's
Yes.
going to be different every day.
It's going to be different. Well, and also kind of along those lines, I just want to mention is the belief that our weight and our body size and shape is malleable. I mean that we can all you have to do is just eat less and exercise, and you'll be thin, right? It's just that easy, right? I mean, and people who've dieted over and over and over, they know it's not that easy, but I have heard that kind of thinking from people who have never experienced the shame of regaining weight that they've lost. It's like, well, just lose weight, and you'll be, just stop eating, and that you'll lose weight. It's a very black and white way of thinking that is, it's just not that easy. Our bodies are not that programmed.
Yeah. What I think is interesting and is worth mentioning here, going back to DBT. So dialectic behavioral therapy was from a mental health standpoint specifically, and there are a lot of ethical implications and conversations around the concept of personality disorders. So I'm just going to say that now, and I know that. And also, so DBT specifically was designed by a woman who has borderline personality disorder. The diagnosis as it stands now. She developed this amazing evidence-based therapy because none existed for folks who were dealing with what she was dealing with. And also, I think it's really, from a mental health perspective, important to note that disordered eating often co-occurs with specifically borderline, but other personality disorder traits at a higher rate.
Yeah,
right. So like often, if we're working with BPD, we are also working with disordered eating, among other things. And so I'm so glad that you know about it, because it is something that, like, really the point of DBT is that yes and, right? It's teaching us to not have that black and white thinking.
Exactly.
It's teaching us to identify interventions and things that we can do that exist in the gray. Because again, as we've just noted, like, things are always changing.
Things are always changing. And none of us are the same every day, right?
Right. And so I think that it's important to know that, like, borderline does show up more frequently with folks who are experiencing disordered eating. Even if it's not like a full-fledged eating disorder, like even those behaviors. And a lot of it is about, again, we're coming back to this idea of control, right? And so a lot of that stuff has to do with trying to control your environment. And if you can't control your environment, then at least you can control your behavior. Or if other areas of your behavior feel out of control, then at least I can control what I put in my mouth. Just sort of like bringing it down in scope.
Right.
Ooh, there's a lot there.
There's a lot there.
Yeah.
But I think that really speaks to the need for therapy, because all of these things can just be unpacked, discussed, worked through with a therapist. And so, that's why I would encourage people to call PRISM Integrative Health. I really mean that. I do. I mean, this is big stuff. This is heavy stuff. And I think it'd be very hard to work through on your own. So,
yeah. And I think also, like, coincidentally, therapists don't know everything. We are limited in what we do, right? And so
I think with dietitians, right?
Yeah. And so that's why we have the model of the integrated health model, right? Is so that where we leave off, you can pick up, and the stuff that we don't. And so we work together to have this model of care that is really multidimensional and holistic, because it's caring for a whole person.
Yeah, exactly.
Yeah. So it looks like you've got an emotional eating cycle here in these slides.
Which
we've sort of covered, but we've got 10 minutes. So I want to make sure that we are covering all the things we want to cover.
Okay. Yeah.
And
So this,
let's walk through this.
yeah. So this is just a visual of the cycle of emotional eating that I think happens for a lot of people. And again, everybody's different. It could be different for different people. But this this is what I see a lot of, is starting with the stress. They're slightly to the top right there. So the person who is not great at identifying their emotions or regulating their emotions or knowing what they're feeling, basically experiences some type of stress, which we all do. And usually it's an intense form of stress. It could be school, work, family, whatever. And feeling any kind of stress for most of us then leads to that desire for some kind of comfort, right? Some way to get rid of that stress, or at least numb it for a while, right? And that is one thing that we didn't talk about is that food, when we're eating, tends to numb our emotions. We get kind of anesthetized, basically, which feels good. You know, if you're really stressed, feels really good to kind of numb out for a while. So that's very normal again. And that right there, people think, oh, well, I'm not controlling myself, blah, blah, blah. Don't worry about it. You know, and getting, numbing your feelings is kind of a normal reaction to stress. It's how you do it, obviously. So in this situation, people, obviously some people turn to alcohol or drugs, but some people turn to food. And so they start to eat. And again, kind of like we talked about earlier, if it's a food that they feel that they shouldn't eat, usually that's either fast food or desserts or kind of the typical bad foods that we shouldn't eat. And because they taste so good, usually people end up eating more than maybe a typical amount. And they usually get a very temporary feeling of relief, like we talked about. Temporary numbing effect kind of takes away that stress. But then the stress comes back. Whatever caused those intense feelings has not gone away, right? So those feelings come back. And then on top of that is the guilt for losing control, the guilt about eating something that they feel that they shouldn't have ate. Again, it could be something that's off their diet or just something they believe is bad for them, or it's like fast food or desserts. People think, oh, I shouldn't eat that. It's high in fat and it's high in sugar and blah, blah, blah. So they have all this guilt and disgust and shame. Okay. And then that just feeds into the stress. And so it just goes around and around and around. And so that's, again, where therapy can help, is interjecting there to stop that cycle.
Yes. I love that one of the things that you teach is to take a pause.
Yes.
Because that's also one of the things that I teach.
Neat. Great.
When I teach it, it's specifically around like a negative internal dialogue and how we talk to ourselves.
Yeah, exactly.
And and so often what I am teaching and what I do is say, okay, so we need to identify and even just notice.
Just notice.
Just notice when you are having that self-deprecating or degrading language, that mean, often language, calling yourself names, whatever, telling yourself that you're stupid or not good enough or whatever. We need to notice it, and we need to take a pause and create enough space where you can do something else. So, whereas, what you're talking about, and I do want to review this, but and we will next, but what I often do is like, okay, so if you have this negative self-talk about who you are, how you are, etc., and generally we know that's untrue. Right. So we need to start, and this is that negative self-talk is coming from an emotional space. Yeah. And so we have to like logic our way out of it. Right. You have to, and so I'll challenge people to say, okay, so like, let's literally disprove that by facts. So like, if you are calling yourself stupid, then you need to disprove it by reminding yourself that you got straight A's last semester,
Exactly.
that you know, like you did X, Y, and Z, that, that whatever it is, that you have hard evidence to disprove the emotional place that you're in.
Mm-hmm.
But you can only do that when you slow down enough to notice.
When
it,
you
right?
slow down. Exactly.
Yep.
Exactly.
So let's talk about,
Yes.
and we started reviewing this a little bit, but I want to give you some time to review it in full
Sure.
before we wrap up.
And I might have to put my phone.
Yeah, this is the action plan, right? This is
Yes.
how we slow down.
Yes.
So take us through it.
Yeah. So the first one is when you're feeling stressed, to put in that pause. Okay.
Mhm.
And I just have to share real quick. My daughter, when she was in high school, she would do this to me, and to this day, she's 20, almost 22 now. But I still think it's like if I would start to get anxious or mad about something, she'd say, "Mom," and she'd go like this. So I always remember this, "Mom, just chill out, pause." So
Yeah.
basically, it's, and I think about that sometimes. But that's basically what it is. If you're starting to feel those stressful feelings, just kind of pause. Okay. Put in that pause. Acknowledge that I'm going to put on my glasses. Acknowledge that you feel the need to eat to soothe yourself.
Yeah.
Okay. Acknowledge that. And you might want to take that observer role. Like, that's interesting. You know, I'm feeling really, pissed off at somebody or something. And now I'm thinking about food. Okay. So just kind of observe it. Don't judge it. Just observe. Then the next thing is, always first try to consider another way to feel better, whether it's to call a friend, to just sit down and meditate, to go for a walk. Take a deep breath.
Yeah.
Like my daughters just did, just like, Mom, center yourself. Okay. But
even doing it now just feels so good.
Yeah. So if eating is what you really want to do, let's say you've done all that and you just really want that chocolate cake that's sitting in your refrigerator. Okay. I say, go ahead, get that chocolate cake, cut out a good sized piece. Don't go with a small piece. Get a good sized piece.
Get the piece you want.
The piece that you want, and put it on a plate. Go sit down. Take another deep breath. And then this is a mindful eating exercise where you take a bite and you taste the chocolate cake and acknowledge that it tastes fantastic. Okay. Or whether it's pizza or a casserole or whatever it is that you're craving. Okay. You taste the food, smell the food, just eat it very slowly. And maybe, drink a glass of water or whatever. And just sit there, take deep breaths, think about what it is that's causing this emotion. What is that emotion? What are you feeling? Kind of give yourself some space to just think about, what am I going to do about this? How can I make this better? But just think about it as you're eating, paying attention to the taste of the food, acknowledging that it tastes amazing. And tell yourself there's nothing wrong with eating a piece of chocolate cake, and it's really making me feel it tastes great right now. Eat slowly and mindfully, tasting every bite. That's the next one. But this is the key right here: is tell yourself this is okay to have this piece of cake. There's nothing wrong with it. It's going to make me feel better. It's going to temporarily make me feel better, but it will not take away the problem. Whatever it is that caused that intense emotion is still there.
Yeah.
But that's okay, And then when you feel full, when you kind of just eat very slowly and you get to the point where you feel like, okay, this was good. This piece of cake was good. And maybe it's 2 pieces, whatever. Okay. Then put the food away when you're done and leave the kitchen or leave the restaurant or leave wherever you are. Leave the closet if you're sitting in your bedroom closet or whatever. But put it away and leave, and then just, make a decision about what you're going to do, and then hopefully try to go do it. Listen to the self-talk that comes in at that point. Don't let those thoughts of, oh, I shouldn't have ate that, I'm disgusting, I'm awful, I lost. Don't let any of that come in. Like, maybe even say to yourself, that was an amazing eating experience, and that really
Yeah.
felt good. What am I going to do now about this situation?
Yeah. Mhm.
So it just takes away the intensity of the emotions when you kind of approaches it that way. And
Mhm.
hopefully you come up with a plan or some kind of resolution of how you're going to, get some help for that, whatever's causing that emotion. And it also
Mhm.
takes the power away from the food.
Yes.
It's so what? You ate 3 pieces of pizza, you ate 2 pieces of cake, whatever.
Yep.
And it made you feel better for,
Yeah.
a couple of minutes, but it didn't take that
Yep.
problem away. So let's work on that and see what you need to
Mhm.
do. So anyway,
Exactly. This is wonderful. Thank you.
you're welcome. Thank you for
Um,
having me. I appreciate it.
so let's see here. Okay. Yes. So we are at our time.
Okay.
We're trying to really keep us to an hour here.
Sure.
And there is so much more that we can and will be talking about. So next month is National Disordered Eating Awareness or National Nutrition Month. So we are doing basically every other week. We have topics from now until July, or through July rather. So we're going to be talking about gut health and disordered eating in March, diabetes, prediabetes, health at every size in April, whole foods, convenience foods, pain management, reducing inflammation in May. Cindy, you're doing intuitive eating part 1 and 2 in June. And then we've got pregnancy, nutrition, intuitive eating, and then managing kidney health with nutrition in July. And so also what's important to note about this is that we've got 2 fantastic dietitians on staff. Cindy is one of them. Madeline Patterson Odell is the other one. And so for the most part, y'all will be switching on and off. So the next time we see everybody on March 10th, it'll be Madeline's turn to present and have this discussion. And if I know anything about her, we are going to learn so much because she is just going to give us a whole education. And I am very excited about this.
Me too, actually.
Yeah, it's going to be so fantastic. And I think God, we could just talk about this all day. Maybe we get another one about emotional eating. I'm going to make a note to myself, we need more.
Yes, I agree.
So if anyone who is watching who does not work for Prism and did not pay for a ticket, any community member wants to donate to the cause so we can keep doing this and keeping it free for everybody. This is a great way to do that. I think I've got it set up for a $1, $3, $5, $10, $15, $20 donation. Also, if you don't feel like it, that's cool. But this is a QR code to scan and do that through Square. So if y'all want to donate, you can. I also will be sending these slides out to folks so they will have access to that. And I think that is it for today. That's today's discussion and presentation. I'm going to stop hiding my screen so I can see everyone. Liani, thank you so much for joining us the whole time. I super appreciate it. I hope you got what you were coming for and that we get to see you again. And Cindy, again, thank you so much for
You're welcome.
All of your knowledge and insight this afternoon. It was really wonderful. And I will see you again soon. So I hope you have a lovely day.
All right. Thanks. You too.
Thank you.
Bye, y'all.
Bye. Is that okay?